Hi friends, welcome back to THANU'S Diaries. Today we are going to deal with NIMHANS exam related question and answers. The first question, volume of enema solution for infants: 100 to 200 ml, 200 to 300 ml, 300 to 400 ml, 400 to 500 ml. The correct answer is 100 to 200 ml. Next question, symptoms of increased intracranial pressure in infant: vomiting, heightened alertness, depressed fontanelle, diarrhea. The correct answer is vomiting. Next question, contraindications for lumbar puncture include increased intracranial pressure, suspected meningitis, Guillain-Barré syndrome, all of the above. The correct answer is increased intracranial pressure. Next question, therapeutic dosage of lithium: 300 to 600 milligram per day, 500 to 800 milligram per day, 900 to 2100 milligram per day, 2000 to 3000 milligram per day. The correct answer is 900 to 2100 milligram per day. Next question, most reliable index of cerebral status. Its options are pupil response, deep tender reflexes, muscle strength, level of consciousness. And the correct answer is level of consciousness. Next question, a client is admitted with a head injury. He has a GCS score 3.54. The nurse understanding of this test is that the client can follow simple commands, will make no attempt to vocalize, is unconscious, is able to open his eyes when spoken to. The correct answer is able to open his eyes when spoken to. Next question, a clear fluid draining from the nose and ear is indicative of rhinorrhea, basilar skull fracture, otitis media, cerebral edema. The correct answer is basilar skull fracture. Next question, a patient with increased ICP is receiving injection mannitol. The nurse's understanding about the reason for administration of this drug is it reduces the secretion of CSF, it increases the urine output, it shifts the fluid by osmosis, thus decrease the ICP, all of the above. The correct answer is it shifts the fluid by osmosis, thus decrease the ICP. Next question, third stage complications of labor is all except postpartum hemorrhage, retained placental fragments, obstructed labor, pulmonary embolism. The correct answer is obstructed labor. Next question, absence to develop valve between the right atrium and right ventricle is known as mitral stenosis, patent ductus arteriosus, tricuspid atresia, pulmonary stenosis. The correct answer is tricuspid atresia. Next question, antidepressant used in children for depression. Options are amitriptyline, fluoxetine, methylphenidate, imipramine. The correct answer is fluoxetine. Next question, which of the following drug is an antidote of opioids? Fluphenazine, flumazenil, benzodiazepines, naloxone. The correct answer, antidote of opioids, is naloxone. Next question, signs of imminent eclampsia. The options are BP more than 160 mm of Hg, nausea, headache, all of the above. The correct answer, blood pressure, more than 160 millimeter of mercury. Next question. Sausage shaped mass in abdominal palpation indicates. Options are pyloric stenosis, appendicitis, intussusception, hernia. The correct answer is intussusception. Next question. Nurse educated teaching about pain management is. Doctor orders painkiller based on the patient's need. Patient can adjust with meter dose based on pain. Modification of painkiller post-operatively, all of the above. The correct answer is doctor orders painkiller based on the patient's need. Next question. Home visit planning will be based on. The options are need of the nurse, need of the client, financial status of the patient, whenever nurse feels. The correct answer is need of the client. Next question. Immediate management of Wernicke's encephalopathy. Administer injection thiamine, ordering electroencephalogram, administer steroids, tap disulfiram. Correct answer is administer injection thiamine. Next question. Delusion of grandiosity is present in depression, mania, dissociative disorder, schizophrenia. The correct answer is delusion of grandiosity is present in mania. Next question. Asthma is an anaphylactic reaction, fluid accumulation in pleura, inflammatory disease, and last option is infection. The correct answer is asthma is an inflammatory disease. Next question. Vomiting will cause metabolic acidosis, metabolic alkalosis, respiratory acidosis, respiratory alkalosis. The vomiting can lead to metabolic alkalosis is the correct answer. Next question. Fluid replacement preferred in hypovolemic shock is isotonic crystalloid, hypertonic crystalloid, hypertonic crystalloid, all of the above. The correct answer is isotonic crystalloid. Next question. The dose of ROGAM is, it's an injection used to prevent RH incompatibility. 300 microgram IM, 200 microgram, 100 microgram, 75 microgram IM within 24 hours of delivery. The correct answer is 300 microgram IM within 72 hours after delivery. Next question. Purpose of antiretroviral therapy is to cure HIV disease, reduce viral RNA load, prevent HIV disease, all of the above. The correct answer is reduce viral RNA load. Next question. Post-operatively, urine sample to be sent for. The options are pus cells, sugar, protein, albumin. The correct answer is pus cells. Next question. Drug of choice for trigeminal neuralgia. Lorazepam, naproxen, carbamazepine. The correct answer is the drug of choice for trigeminal neuralgia, carbamazepine. Next question. What is often the first symptom of Parkinson's disease? Headache, nausea, shaking of hand or foot, turning of head. The correct answer is shaking of hand or foot is the first symptom of Parkinson's disease. Next question. Parkinsonism is an. The options are inflammation of nerve pathway, autoimmune disorder, degenerative disorder, nutritional deficiency disorder. The correct answer is degenerative disorder. Next question. Earliest sign of myasthenia gravis is ptosis, diplopia, ascending weakness, presbycusis. The correct answer is ptosis. In myasthenia gravis, dissenting type of paralysis or weakness is seen. Next question. Sign of Guillain-Barré syndrome include weakness, diplopia, muscle rigidity, tremors. The correct answer is weakness. Next question. False fixed belief or ideas is known as. The options are hallucinations, illusion, confabulation, delusion. The correct answer is delusion is known as false fixed belief or ideas. Next question. Physiological jaundice occurs between 0 to 24 hours, 0 to 72 hours, 24 to 72 hours, after 72 hours. The correct answer is 24 to 72 hours. The next question. What is public health nursing? Providing care to the client who is not in hospital, providing free treatment in the hospital, primary focus is on advanced surgical interventions, all of the above. Correct answer is providing care to the client who is not in hospital. Next question. Which of the following is not an antipsychotic medication? The options are haloperidol, imipramine, risperidone, olanzapine. The correct answer is imipramine. Imipramine is an antidepressant medication. Next, normal head circumference at birth. Options are 30 cm, 35 cm, 40 cm, 45 cm. The head circumference at birth is correct answer 35 cm. Next question. Sex ratio is defined as number of females for 1000 males, males for 100 females, females for 100 males, males for 100 females. Correct answer is females for 1000 males. Next question. Disinfectant of choice for soiled instrument. The options are glutaraldehyde, formaldehyde, hypochlorite solution, 70% alcohol. The correct answer is glutaraldehyde. Next question. Management of hypernatremia includes restrict water, administer furosemide, free water through Ryle's tube or by mouth, administer normal saline. Correct answer is free water through Ryle's tube or by mouth. Next question. Teaching parents of autistic child should include be consistent, change the routine frequently, set limits, all of the above. The correct answer be consistent. Next question. Disulfiram ethanol reaction is characterized by bradycardia, sweating and hypertension, headache, hypertension and chest pain, hypertension, bradycardia and blurred vision, tachypnea, hypertension and vomiting. The correct answer, headache, hypertension, chest pain. Next question, specific test for varicose veins. It's Trendelenburg test, Allen's test, Homan's sign, Koenig's test. Correct answer, Trendelenburg test. Next question, global loss of memory, cognition and personality is known as delirium, dissociative disorder, Alzheimer's type dementia, conversion disorder. The correct answer is Alzheimer's type dementia. Next question, which is characterized by recurrent recollection, flashbacks or images or thoughts in dream? Acute stress disorder, post-traumatic stress disorder, psychosomatic disorder, sleep disorder. The correct answer, post-traumatic stress disorder. Next question, preoccupation with details or rules list order is seen in which type of personality? Narcissistic, histrionic, obsessive compulsive, borderline personality. The correct answer is obsessive compulsive personality. Next question, cluster A of the personality disorders includes which disorders? Antisocial, narcissistic and borderline, paranoid, schizotypal and schizoid, avoidant, obsessive and dependent, avoidant, schizoid and antisocial. The correct answer is paranoid, schizotypal and schizoid. Next question, discharge teaching of paraplegic patient for home care. Options, intermittent catheterization, percutaneous nephrostomy, suprapubic catheterization, heel conduit. The correct answer is intermittent catheterization. Next question, spinal cord injury patients will develop, the options are loss of bladder control, preservation of bowel control, Cullen sign, Batter sign. The correct answer is loss of bladder control. Next question, sacralization is a frequent cause of inclination dystocia, paraplegia, hemiplegia, paresthesia. The correct answer is inclination dystocia. Next question, type 1 hypersensitivity is an antibody dependent process, anaphylactic reaction, cell mediated process, delayed hypersensitivity. The correct answer is anaphylactic reaction. Next question, ligament which present in pectoral fascia of breast. Corpus ligament, round ligament, broad ligament, linear ligament. The correct answer is corpus ligament. Next question, characteristics of malignancy includes controlled growth, invasiveness, defined margin, all of the above. The correct answer is invasiveness. Next question, major cause of mortality associated with anorexia nervosa is? Options, obesity, malnutrition, electrolyte imbalance, nausea and vomiting. The correct answer is electrolyte imbalance. Next question, drug of choice for catatonia. Options, benzodiazepines, haloperidol, carbamazepine, sodium valproate. The correct answer is benzodiazepines. Next question. Presbyopia is short-sightedness, far-sightedness, changes in curvature of the lens, retinal detachment. The correct answer, far-sightedness. Next question. Signs of ectopic pregnancy include painless vaginal bleeding, sharp abdominal pain, rebound tenderness, bogey abdomen. The correct answer, sharp abdominal pain. Next question. Fertilization takes place in options: ovary, uterus, cervix, fallopian tube. The correct answer, fallopian tube, mainly in ambula. Next question. Nursing intervention appropriate for patient with increased ICP. Provide supine position to the client. Use bright lights in the room. Elevate the head in 50 to 30 degree to hourly suctioning. The correct answer, elevate the head end of bed 15 to 30 degree. Next question. Most appropriate nursing action to a depressed client who do not want to join a group is to tell her the rules of the unit, better get out of the bed or she will be hungry, tell her that the nurse will assist her out of the bed and help her to dress, allow her to remain in bed until she feels ready to join the other patients. Correct answer, tell her that the nurse will assist her out of the bed. Next question. Optimum bed occupancy of hospital is 80%, 85%, 90%, 95%. The correct answer, 85%. Next question. Hand washing day observed on September 15, October 15, November 15, December 15. It's observed in, correct answer, October 15. Next question. Bloom's taxonomy is used as learning domains, skill domain, affective domain, cognitive domain. The correct answer is learning domains. Next question. Directive counseling is also known as client-oriented counseling, personal counseling, group counseling, counselor-centered or prescriptive counseling. The correct answer, counselor-centered or prescriptive counseling. Next question. How long does an ovum viable after ovulation? Less than 12 hours, 12 to 24 hours, 24 to 48 hours, 48 to 72 hours. The correct answer, 12 to 24 hours. Next question. Reflux which present at 9 months of age is all except tonic neck reflux, parachute reflux, swallowing, sucking. The correct answer is tonic neck reflux. Next. Which of the following advice is appropriate for a mother who refuses to immunize her baby? Vaccines are expensive and here you get it free. Immunization is okay for your child. It's up to you. If your baby get illness, vaccines will prevent disease. Correct answer, vaccines will prevent diseases. Next question. What is the initial nursing action for a client who is in the clonic phase of a tonic-clonic seizure? Gently restrain the extremities, insert a padded mouth guard, place some padding under the head, get ready the equipment for orotracheal suctioning. Correct answer, place some padding under the head. Next question. A 47-year-old female client with a diagnosis of depression has been in the hospital for 3 days. During this time, she has not maintained her personal hygiene and show no interest in ward activities. On this way, the nurse observed that she is wearing a clean dress and has combed her hair. In working with a depressed client, the nurse should understand that depression is most likely related to persons. The correct answer is having experienced a sense of loss. Okay. Next question. The client has been on long-term phenothiazines. Patient heart jerky, cough movements, lip smacking, neck and back tonic contraction. This indicates that the patient has developed tardive dyskinesia, Parkinsonism, dystonia, akathisia. The correct answer is tardive dyskinesia. It's an extrapyramidal symptom. Next question. A patient with diagnosis of BPAD is being discharged from the hospital with a regular lithium medication. The most important information to impart to the client and his family in the discharge teaching is that the patient should. The correct answer, have an adequate intake of sodium. Next question. The nurse has to administer phenytoin 100 mg IV as an anticonvulsant. The priority action while administering this drug is to assess for infiltration of the drug, assess for effects of the drug, assess pupil dilatation, administer the drug as quickly as possible to prevent a seizure. Correct answer is assess for infiltration of the drug. Next question. While caring for a patient who is in myasthenic and cholinergic crisis, which of the following is essential nursing knowledge when caring for a client in crisis? The correct answer, weakness and paralysis of the muscles for swallowing and breathing occur in either crisis. Okay. And here is the final question, and thank you to everyone